Welcome to the Rotunda, the longest-running maternity hospital in the world and the busiest in Europe.
We're here! Woohoo!
It has seen the birth of close to 1 million Dubliners, and this year, some 25 new babies have been added to that number every day.
Black hair just sticking out.
Hello!
Oh my God!
I know.
It's a place of extreme highs and devastating lows. During the pandemic, one of the most challenging times in living memory.
I'd like to be in there, but the numbers aren't going down at the minute.
We have a date.
It's agony and ecstasy side by side as people experience events which will change their lives forever.
I'd do it again.
Events to be remembered and retold for generations to come.
Pandemic babies. Look at you.
The patient's experience during COVID has been extremely difficult. If your partner is going through something very difficult and you cannot be there to support her, it is very, very upsetting. I've had to do some counselling on loudspeaker on the telephone, just to allow somebody to even have a second person listening to what I'm saying. It's very unnatural not to be able to sometimes even give somebody a hug. Even this elbow thing, it just doesn't do it for me or for the patients.
It's 4:30 a.m. and first-time mum Michaela and her partner Mark have arrived at the Rotunda with the first signs of contractions.
The girl at reception was like, I'm so sorry, I have to kick you out. I was like, oh, it's okay. And then I went outside. I seen there were full row cars outside the Rotunda where, people sleeping in them.
Waiting for the
call to come back in. So I did the same thing, followed suit, hopped in the car and tried to go to sleep, but it was getting 5:30 stage, the sun was starting to come up. I think he called me and I said, I'll just go home.
Mark had to wait until 4 p.m. to be back by Michaela's side. 4 hours later, it's time to leave again.
He had to leave at 8 o'clock. That's when visiting hours were over.
Be brave.
He went all the way back to Baytown. At 10 o'clock, I got to the 3 centimetres. So I call him on the phone, I say, hey, I'm the 3 centimetres, come back in.
Yeah.
And he goes, are you serious? I just closed my eyes. I was like, oh, I'm sorry, this timing's not good for you. Do you want me to hold this baby in until you get your rest? So he's like, all right, I'll come back in. I was like, yeah, better come back in. Don't give me that attitude, you know what I'm saying?
I feel happy.
It's 11 p.m. Michaela's contractions are now regular and strong. While gas is helping, she has requested an epidural.
I was just wondering when the epidural's going to be here.
No, in 2 minutes.
Okay, good.
Other gas. Anyway, that's good that she's laughing.
Yeah.
Are you okay?
I'm crying.
That's it, there you are.
I'm 26.
And I'm 21.
We're together 3.5 years now.
Yeah.
Oh, holy moly, this is hard.
Well, we met online.
Yeah, on POF. I swiped right, so it was love at first swipe, you know what I'm saying?
We're winning. It's oh God. Almost from the get-go, we both wanted children. I wanted to wait till I was around now. And Michaela said she always wanted to have children early.
Young, yeah.
Be a young mummy.
Yeah.
And
Yummy mummy.
yeah.
And what are you having?
A boy.
A little bit maybe. And what do you have a name for him yet?
It's going to be Elliot.
Elliot, a lovely name. Great name. Elliot from
E.T.
Phone
Phone
Home.
Home, yeah.
Lovely.
Hopefully he's not going to be slagged and be like, Elliot, at school. So.
I was 19 when we bought our house. It's a lot different to my mates at this stage because they would be clubbing and partying and we did buy a house when I was still a teen,
What time is it anyway? Almost 3 o'clock.
3 o'clock. You didn't miss out on much as well, having
Yeah.
being pregnant during COVID because everywhere was shut. You weren't being envious of your friends going out or like that, you know.
Seeing photos on Instagram, like, of the girls going out or having drinks, or I never got that jealousy, you know, because no one could do it. So I was like, oh, this is great because we're all suffering together, so why not do it now, you know?
So shaken.
Yeah, I know. It comes and goes. I don't know.
Your contractions are nice and regular. They're regular and they're strong.
Good.
You can do this, and you are doing it.
Yeah.
Youth helps.
Yeah.
You're young, which is good. There's no athletes running on the pitch at 50 odd years of age, you know.
Youth may be on her side, but during Michaela's pregnancy, her age wasn't always taken in a positive light.
Being 21, being pregnant, I have had like a few questions, feeling judgment because I am young, like was it planned? So sometimes it can be hurtful because people could think that like he's a mistake when he's not a mistake. Like,
It obviously helps. The body's more flexible.
yeah,
And then the older you get wiser in the brain, but stiffer in the joints. And you think,
it was our first month trying, and we were pregnant, you know. So
Happens so quick.
yeah, I'm a fertile thing. I am. My eggs are good.
you have youth on your side, and you've got brains to burn.
Thank
You've got
you.
everything. Unlike me. I'm getting things beginning to seize up. That's all ahead of you.
Yeah.
Would you be like, yeah?
Do you want to do the abs there?
I've done it.
Oh my God, you're a star. Did you go through all these?
I did.
Oh my God, where was I? Was I gone for that long? You're very good. Thanks. So it's really important, Patricia, that you always speak about reduced fetal movements, PV loss or pain. Is that all right?
And then go to the emergencies.
Yeah, I know you know this stuff, but I just... You can tell me to shut up silently in your head. Don't tell me.
Shut up.
Yeah, stop talking.
Just 4 weeks ago, Joyce left Nigeria in difficult circumstances. She was 29 weeks pregnant with her much-wanted first child.
I'm 36. I've been married for some time. I've always prayed to have children. Finally, my prayers has been answered. When I was 8 weeks, we went for scan. They said, there is baby there. They say heartbeat. That was the last scan I went for in Nigeria.
When Joyce arrived in Ireland, she was accepted into direct provision. Shortly afterwards, she had her first scan in the Rotunda.
Last month, I was having pains. I couldn't move. So they brought me to emergency. The doctor scanned.
The scan revealed that there was more than one heartbeat.
When I scanned in Nigeria, it was 1. Now you're telling me 3. So I was never knew that it's going to be, my dream is going to come true. And it's coming with a surprise that I was thinking that it's 1 at the end of the day. I'm having 3.
Now 34 weeks pregnant, Joyce's triplets will be delivered in theatre today. She is in Ireland without any family and has been unable to speak with or see her husband since early in the pregnancy.
I do get scared because nobody around me. I still wish maybe I can see my husband.
It must be really scary arriving in a foreign country with no partner and no friends or family or no support, and then having 3 babies.
I'll sit with you, okay?
She's better company than most people.
Still smiling anyway, that's a good sign, isn't it? It is a very, very nerve-wracking experience for anyone, I suppose, coming to a theatre department. Like, she just looked at me and I told her everything was going to be okay, and she held my hand, but when she looked at me, she was like, she was putting all her trust in me.
I have to be strong for this baby. It's not that I'm going for an operation because of my heart or anything. I'm going to bring out life.
With 3 small babies, and they were all premature as well.
We never know until we actually go in and open up the uterus what way the babies are coming. We only knew that there was one boy and one girl and then one unknown.
A lot of shoulder trying to come out.
Wow.
Really?
The first little boy came out head first. That was easy peasy.
Little lips trying to come out here. Okay, there we go. There we go. Wow. Look at you. Hello. Now, number one is a boy. There's your first little man. He is. He's perfect.
Wow. So do you have any names for them, Joyce?
Yes.
What are you going to call them?
But they were all going to begin with the same letter, weren't they, I think?
The first one
Yeah?
is Abby.
Abby. Lovely.
There's a head over there. And then the other head is kind of here.
Then it was a little bit tricky trying to feel around to see was baby B or C coming next.
Don't just grab that foot.
Yeah.
Cool.
Got a hand. I kept finding a hand and I didn't know whose hand it was. I was trying to kind of push that back out of the way and see if I could either find a little head or a little bum or a foot. You just have to sort of take your time and not panic.
I think I have the other foot here, right? Yeah, brilliant.
Like now, I've known that one is boy, one is girl. I'm still hoping, I believe that the other one is boy. So, because you have two boys and a girl, I would want those two boys to protect their sister.
Wow, look at you.
And it's another little boy.
Aww. Aren't you perfect? Oh, okay. So
What do we got now?
Then the second one is Asha.
Asha.
One more to go.
So then there was just one remaining baby left inside, so that's much easier to be able to feel around and see if we can find another little foot to be able to grab the foot and guide the baby out.
wow. Hello, happy birthday.
Lady.
This was a girl.
And what's the little girl's name?
Abigail.
Abigail, that's so cute. All A's, yeah.
Third one is Daisy, princess.
Princess. She will be a princess, won't she? Definitely.
Tiny, tiny. Ah, great. Thank you.
Where's my girl?
Oh, she's coming. The princess is arriving. They'll make her entrance. Oh, is this her? Oh, look at her. Little tint. Adam. She's gorgeous. This was a massive thing for this lady. I mean, she was just so calm, so grateful at being a mom for the first time to 3 babies. Such an amazing woman.
My babies are here.
They're so here, aren't they?
Are you in any pain?
No, not right now, no.
No. Good, good.
Yeah.
Epidural's working okay.
Yeah.
Right.
Numbed half her body.
Michaela's labour is progressing very well, and with an epidural on board, she can't even feel her contractions.
I think something's coming out me. I don't know.
I always imagine when your waters pop, it's just one gush and that's it. More came out and I was like, oh my God, like, did I just wet myself?
I don't know if something's happening. I just feel like something's coming out.
Okay. Well, we better check that out.
Yeah. Can your waters
Yeah, oh yeah, they
just
certainly
keep
can.
going?
They certainly can.
Feels so weird.
Why are you starting to drop the... Oh my God.
I know.
Oh my God.
Yeah. You have the River Liffey down there.
I know.
They just didn't stop coming out. I was like, what is going on with me?
Give me a moment.
Is it really bad, man?
Yeah. Called in another midwife.
No.
Hi.
No stream like the...
For help?
You're like Anna Livia lying there. The floozy in the jacuzzi.
Yeah.
Do you remember her?
No.
Do you not remember? You must, of course, you see, you're young. Anna Livia, actually, Annie Livia was like you in the bed there. Except she was in O'Connell Street.
Okay.
She represented the River Liffey. You were representing the River Liffey here.
Oh my God. Like it literally won't stop.
Ladies think that when their waters go, that is just it, that they won't continue to come. It can come as quite a surprise that sometimes there's quite an amount of water they didn't expect, a lot more than they expect.
Yeah, oh my goodness. Yeah, God, well, there you go. Water, water everywhere.
Not a drop to drink.
Yeah, well, I wouldn't be drinking that.
He was gas, like he was so funny. It made the atmosphere in the room really positive.
Yeah.
I seem to be getting that pressure again.
Right, you know what? I'm thinking we're nearly time to examine.
Okay.
Something telling me you've advanced.
There's a waterfall going on.
Yeah, well, you know what? I don't need convincing now.
I'm
You've really
nervous.
efficiently moved along.
Yeah, I'm nervous to know now.
Good. Huh?
I'm nervous.
You're wondering what if you're not fully?
No, I'm nervous that I will be.
Take a deep breath. Hold a deep breath. Push my fingers away. Just push down. Oh, you're gonna have no problem. You're gonna have no problem. Oh, but,
Am I
okay.
fully?
You're fully.
Oh.
It means the cervix is gone. The cervix has got out of the way.
Okay.
I've just examined.
Hello.
Hi.
Fully dilated.
Oh my God, well done.
I know.
That's great.
Yeah.
Very good.
Flying
Oh,
along.
you're flying.
Yeah.
That's
So
very good.
start pushing in an hour.
Joyce is recovering after the delivery of her triplets. She faces an uncertain future for now in direct provision without her husband or her family to support her.
Okay, the long-awaited triplet has finally arrived. Yes, seeing my children today, the sadness subside from me. At least I know that I'm no longer alone in this place. My children is with me. My family is with me because they are my family. I would like to hold them in my arms, the three of them together. I would like to hold them, to feel them.
The babies will be cared for in the Neonatal Intensive Care Unit until they grow stronger and reach their due date.
They are breathing on their own. They don't need any kind of respiratory support, which is amazing.
While in hospital, recovering from surgery, Joyce will have unrestricted access to her 3 babies.
The first boy. Abby.
Oh my God, that's so cute.
It's good because it's every woman's wish to be a mother. Yeah, as a woman that brought me this world, I'm happy bringing children to this world because it's very, very good.
This is Asha.
Asha, darling. You know, that word mother is something that I have to get used to till they grow up. My angel. Abby girl. So, and my dream is for them to have a good life. Princess. I want the world to know them because of their doings. Very much excited. I couldn't even sleep. I tried to sleep, but I was eager to come and see them. My plans, I'm staying here. I've come to like this place because it's peaceful. Daddy loves you too. Lovely, overwhelming, happy, and I feel great. Being a mother of 3 is very, very good and interesting. I love you so much. I love you guys so very much.
Time for Shawnee to get an apron on. Are you ready to rock anyway?
I'm ready.
In as much as you'll be, yeah.
Nervous but ready.
It's 4:50 a.m. After 7 hours of active labour, it's time for Michaela and Mark to get ready to see their first child, Elliot.
Now, this is like being in the ringside with Katie Taylor. That's your job. Mop the brow.
Alright.
Keep it going.
John just kept cracking jokes like.
You look after that end. You do heads and I'll do tails, okay?
Kept going, kept the spirits up.
Yeah. Big deep breath, big push. Here comes baby already. Here comes Bambino.
Squeeze your hands as hard as you want.
Very good.
It's hurting.
The biggest challenge was when I was pushing him out.
Okay, you're doing fine.
I found that absolutely exhausting because I just was so drained.
You're doing brilliant.
I can't do it.
I felt like, is he ever going to come?
Come on, give us one more because it is still there.
Wow, he's nearly there. He's coming.
him being calm me down. Like I feel if he was anxious or he was stressed, I'd feel that, and then I'd start like freaking out.
Sitting there now. Big hairy head in him. Yeah, he does. Is it?
Does he look a little ginger?
And then you just chin down, give your all.
That was a big one. That was a good one.
Hello, baby.
Oh, wow. Baby, he's coming.
Give us a push.
Once the head came out,
The body just
flew out,
didn't
you
it?
know.
Yeah.
Oh my goodness. Oh my goodness, baby.
Hello.
Oh my god, baby.
Happy birthday, baby. 25 past 5 in the morning. Up she goes, over she goes.
Oh my god, baby.
Oh God, when I first saw him, the screams out of him, like, that's the loudest baby scream I've ever heard.
Got that lungs on him.
I heard all the other babies crying, they were like, "Ah, ah," and then Elliot was like, "Ah!" He looks like me! Oh, you're so cute! Megan did a good job! You're a dad, Mark.
That's what.
I was lost for words when he first popped out, you know, he's like, you brought this
Yeah, you
little
just saw
person into the
the
world and you're like, oh my god, like, I have to look after you for the next
yeah.
rest of my
I've
life sort of
designed
thing, you
stuff
know.
for you.
Thanks.
You won't get better days than this.
You can't describe just the instant love and affection you show for him. I don't know, it's just so natural.
Good.
Yeah.
Oh, you look glossy-eyed.
Well,
Don't be riding the man up.
It's bound to happen, isn't it?
He's, you couldn't help but be proud.
Oh, he's such a little tongue. I'll do it again.
His little tongue.
Could have 2, could have 4, you know, could have 6. You never know, or could just stay at 1, you know. What?
6. Not a chance.
I might joke, but you never know.
He's beautiful, isn't he?
You're Smith.
Of course I am. Look at him. He looks just like me.
Together. Let's sit together.
It's 9:20 p.m. and Rose and Slavy have arrived at the hospital just in the nick of time. Less than 3 hours ago, Rose was walking around their neighbourhood in Kildare, hoping she could bring on her first contractions.
I went for a walk with my mom. We walked for 6K and then I went back home at a little bit past 6 in the evening. And at 7 I started feeling some contractions. Suddenly something happened and from 8 minutes they started on 3 minutes. And this is when I told him, okay, we have to go.
Hello, I'm Ruth. Nice to meet you. Where are you? Sorry.
This is the couple's third baby, so as soon as the contractions started, Rose knew that they needed to get to the hospital as fast as possible.
I didn't break the speed limit. No.
No, because our car is not fast enough to break the limit.
What?
Yeah.
We were in a rush.
Well, wait for that to go, all right? Well done.
I was just came to decision if there's guard on the road and they start chasing us, I won't stop. I'm just gonna drive. I might open the window and shout at them. We're going to Rotunda. Follow us or to guide us.
Do you want to start getting out the baby stuff for me? And if you just pop it on the warmer there.
I still remember the lights on the keys. It was green, it was yellow or orange. So I had to make a decision, will I go? But I knew she will be, yeah, she will be not happy. I did.
He went and my waters broke.
And yeah, that happened.
So he helped me.
And she was like, are you crazy? Are you crazy? What are you doing? We have to get their life.
And your waters just went at 9 o'clock. And you're 5, so you're doing good stuff. Sorry? You're doing good stuff.
That's our experience, driving from Kildare to Dublin for the labour.
Just on time. We went just on time.
Are you having a boy or a girl? A girl, lovely. What do you have at home?
We have 1 girl and 1 boy already.
Okay, so the boy's outnumbered now. Yeah.
Special one.
Rose and Slavy met while working together in Bulgaria.
We met at the ski resorts in Bulgaria, 2010.
No, 2009.
2009. I had my eye on her because obviously I liked her look, how she looks. I was a little bit shy actually to go and talk to her first. I want her attention, but I know she's not single at the time, so I just sat and waited.
Is that okay?
Yeah.
And then a kiss. I remember that I initiated that kiss, but if you ask him, he initiated the kiss, so it depends who you ask me. It was me. We were celebrating our 10 years wedding anniversary. That was at the end of August. And then in September, we were surprised after the celebration that, we have a present for our 10 years anniversary.
Did you have quick deliveries on the other two?
Yeah.
Yeah.
Especially the second one.
Well, that was even quicker. Hopefully the same again.
There's such a cultural piece about acceptance of epidural analgesia in labour. So I've done some work in Malawi, in the third world, and the midwifery staff there spent their time laughing at me because they couldn't believe that my job was to provide pain relief for women in labour. It was just beyond their comprehension. But yet in some countries around the world, the epidural rates are almost 100%. You do see patients who are absolutely against an epidural until they labour and then change their mind. And then, of course, you see patients who are adamant that they want an epidural, and sometimes they deliver too quickly to have their epidural. So it's not perfect all the time, but we do try and treat patients very individually to help them get through their labour and delivery.
Hi, Nana. Hi, Nana. Sonny, hello, Sonny. Hello.
Jenny is in the hospital today for her 20-week scan, accompanied by her mum, her husband and their only child, Sonny. Before Sonny was born, Jenny and her husband suffered the loss of 5 babies through miscarriage.
The first one was nearly 7 years ago. We found out that I miscarried at 12 weeks. We were told by one of the midwives, straightforward, you don't really drink, you don't smoke, it's going to be an easy pregnancy. I remember they were doing the scan and it was just like a black hole. It was like the ground opened up. We had to go down and get bloods for my HCG levels, and you were sitting in between all these pregnant women beside you, side by side with you, and you were just totally grief-stricken. You don't know how you took one step in front of the other. And it was just devastating. It was within 6 months then I got pregnant again, and we found out that I miscarried at 9 weeks. And then I had 3rd, 4th and 5th miscarriages between 6 and 8 weeks. And they were all kind of 6 to 8 months apart.
When you see patients coming back in subsequent pregnancies, having suffered from miscarriage, even one miscarriage before, you can see the stress and the anxiety when they come in for the scan. And this stress and anxiety doesn't disappear until they hear the heartbeat. In Jenny's case, even I was anxious whenever I was seeing her name on the list when she was coming in for early scan, because you're rooting for your patients. You want them to have a healthy pregnancy. You don't want complications, and you don't want to give them bad news.
We've been in scans before. I think it was the 3rd miscarriage I had, and I had bleed and we went into hospital. They scanned me and it was the baby's heartbeat, but it was really slow. And I remember somebody gave out to me that I needed to stop and stop being so anxious. And I remember I literally sat in the car and I started to bleed, and yeah, I suppose the baby was dying at that stage. And part of you knew.
1 in every 5 pregnancies ends in miscarriage. but it's extremely rare to lose 5 babies in a row. Although heartbroken, Jenny and her husband Scott were determined to not give up hope.
We had loads of bloods done, really invasive procedures. We had things that make you feel really uncomfortable and that you kind of question yourself, are we doing the right thing? You have a limit, you have a breaking point. And unless you've walked in those shoes and you've come out of the clinic or you've come out of the hospital knowing that your baby has died, you've no understanding. When I got pregnant down on the 6th pregnancy, I said, if this isn't a success, I have to draw the line. And then kind of after the 20-week scan, you kind of, you became really hopeful that we were going to have a baby.
Jenny's 6th pregnancy continued to full term, and Sonny was born 18 months ago.
And then when he was born, it was just the best thing ever. He's brilliant, like. And it just felt like everything was possible then. Because it was kind of against the odds, you know, so it was just brilliant having him because you felt the world was brighter.
Now 20 weeks pregnant, Jenny is relieved to have passed the point where she previously miscarried. As part of her treatment, she has to inject blood-thinning medication under her skin, causing bruising. For today's scan, Jenny is allowed to have her husband Scott with her.
20-week scan, from a medical point of view, it's always really important to know that the baby is okay, that all the organs are okay. It's hugely reassuring, and I suppose from COVID, it's the only scan that Scott can go into as well. So, like, you feel that I understand the restrictions, but that he's missed out on he would have been in every doctor's appointment before, even when I wasn't pregnant.
Lips the baby's nose. So there's the nostrils. Oh my God. There's the lips, top lip, bottom lip, and the chin. So your baby's lips are...
You're holding your breath until you hear that heartbeat, you know, and it's the one thing that you really want to hear. And when we hear the big thud of the heartbeat, you just know that the baby's okay, you know, and everything is okay.
I'd be happy whether it's a boy or a girl once baby's okay. And they're happy, that's all that matters really. Once baby's fine. Yeah.
So you do want me to check the gender, do you? Yeah. Last chance to change your mind?
Yeah.
Okay. I hope your baby shows me now. Come on, baby. Come on. Could you uncross your legs for me there, Jennifer, and bend your knees up and lift your bum off the bed and give me a little wiggle? Sometimes this helps shift baby right. Okay. And rest those legs down again. Let's see. Come on. Yep.
It's just knowing that it's okay, the baby's okay.
Jennifer, we're just coming to the end of the scan here. I'm really happy with everything I'm seeing here. I can't see any physical defects with your baby, and I can't see any markers that would suggest a chromosomal problem. Right. So everything here is very, very reassuring. It means it's very unlikely there's going to be anything.
Right. Here's Mammy. Here's Mammy. If it was a girl, Mammy would be delighted, but if it's a boy, she'd be delighted too. Is it a girl? It's a boy. Another boy. Huh? A little baby's perfect, thank God, and a little brother for Sonny. So delighted. Delighted.
Like me, myself, I didn't get it until I had a miscarriage. And I think that unless people have experienced loss, stillborn babies or miscarriages, I don't think anybody has any understanding in how devastating it is.
The restrictions had a big impact on parents. Knowing that your child was in the neonatal intensive care, especially if they were premature, not being able to see them as often as they wanted, has a huge toll on parents. We have seen cases, not in the Rotunda hospital, but from other centres, whereby premature infants getting a COVID infection meant that they became extremely unwell. They struggle with their breathing, they become very difficult to ventilate, and their heart can also suffer. We had to balance the risk of infection spreading in our unit with the fact that the babies need their primary carers, which are their parents.
That's it. Well done.
Rose and Slavy are hoping for the safe arrival of their third child. It's less than 2.5 hours since Rose's first contraction.
I had very straightforward births, my first two, and I didn't took any pain relief. With the first one, it took me 9 hours from the first contraction to deliver, and with the second, it was just 4 hours.
Have a push. Do you feel like pushing?
Yeah.
That's good, isn't it? That's what we want.
Rose is as cool as a cucumber, but obviously could just tell by her demeanour that the birth was probably going to be imminent.
Well done. You're okay. Do whatever you feel, okay?
I'm so sorry.
No, you're doing really well.
Oh. She wasn't afraid at all. She just let her body do everything.
Isn't it early?
I'd say, I don't think you're 5 anymore. But your body's giving me all the signs that you're progressing very quickly. So just do whatever you feel. So I think she's come right down because her heart rate's dropped a little bit. So if it doesn't go back up, we might see if it start pushing at the next contraction. Okay.
When you have a contraction, it's just like 1 minute where everything, it's so painful. But you know that it's just a minute, and when the contraction is over, you feel so relieved that finally it's over, and you can relax for 2-3 minutes until the next one.
I was there for support, but it was nothing I can do. I was just sitting there, and I was like, okay, you're doing well. Yeah, okay. I was also worried about it because I knew what she has to go through. I asked myself if anything happened. You know, everything could happen. So I was nervous.
Feeling somewhat helpless, this is a very different experience for Slavy compared to the birth of their first child.
I knew it's going to happen quick, judging by the previous two. Our first daughter was born in Bulgaria. The system there is completely different than here. Fathers are not allowed. You're only allowed to see your child after a certain period of time.
After 3 days.
After 3 days. And here in Rotunda, I was so excited and nervous. The experience was amazing. Kind of being there with her.
It's just emotional. It's really different, and it helps.
Just going to get 20 minutes of this, and then we can take it off. I think the baby will be born before the 20 minutes.
Yeah, I think so.
So it's a race.
It was such a huge approach.
Yeah.
It's coming again now.
It's coming again? Don't be afraid. If you feel like pushing, that's okay.
Trying a bit of
Maybe
race
we might
to
get
myself.
a bit 6 at a time then. Maybe.
Huh?
6 at a time.
Ash will go. So move them along to you then, yeah?
Yeah.
Many hands and all that.
Exactly.
And too many cooks.
And what did your last slave die of?
Disobedience. Think on.
Oh, well done. Baby's head is just there.
Rose and Slavy had a hasty journey this evening to make it to the Rotunda for Rose's labour. Just 23 minutes after arriving, their baby is almost here.
We didn't even talk too much with the midwife, but we kind of understood each other with the sight. Okay, I'm ready. Come here, and she came. I pushed once.
That's it, and the head is out. 21:39. Well done.
I remember she was saying, "Oh, the head is out."
The head is out.
And we were like, "Oh wow, is this happening?"
The head's just going to turn now. If you open out that leg a bit, well done.
And then she pushed once.
Won't be long. For the body, you'll push.
And then she pushed twice, and that was it.
Oh, I think she's coming already. You can give a push if the contraction's still there. Well done. Look at you.
Okay.
And she's a girl. Yeah, didn't even have a time.
It was super quick.
Oh, she's a nice size, isn't she?
Yes.
You're a good chunk, aren't you? Oh, well done.
Hello.
Baby came out very rapidly. Well done. Get rid of that wet one. You're some woman. Just in, had a baby. I had a bit of a warning, but I didn't think it was going to quite be that quick.
You feel relieved and excited. For me, it's just laugh.
She turned pink within a few seconds, didn't she? She's very good.
Yeah.
I love you so much. She was so chubby, so pink. She was just perfect. And she's big. I was so happy to say that the baby is big, actually.
Do you want to do some skin to skin? Put her in under your top? Yeah.
The bond, for me, is very important. Waiting for that moment so they can say, you want to do the skin to skin, because I was waiting for that so I can hold my child.
She's very quiet with you.
Yeah, I think she's nice.
Yeah.
For me, being there was, it was wild.
Не ви държахме много в напрежение. Старахме се по-бързично. Добре, че Слави кара бързо.
So pretty. For Bulgaria, it's very unlikely to have 3 children. Like you have 1, and if you're lucky, you have 2, but no one's thinking about 3.
Having a tree, you're considered
a hero.
Yes.
While at a checkup in the hospital today, Jenny began to feel contractions, and so she has been admitted.
I went in for my review with Dr. Cushell, and when we came around the corner to come into the hospital, I felt I was getting contractions. So I kind of sat it out in the waiting room, and when I went in to see him, I just said to him, I think I'm in labour. Labour in this.
How are you?
So,
Is the pain sort of getting worse, you think?
yeah, it's quite intense.
I'm
feeling really nauseous as well.
Okay. So do you think it's a little bit different from like the discomfort that you were getting before?
Yeah, it's kind of, the pains are kind of going down further. Yeah.
So do you think it's...
I feel it's imminent. I feel it's
getting
it's only a matter of time.
Okay. You know, I discuss with Thea and see whether we can get a time to bring you in and deliver the baby, pass cesarean section, and do it in the next couple of hours, you know.
Okay.
When you have a patient like Jennifer, where I've known her for a couple of years and I've seen how devastated she was with, bad news, it goes beyond doctor and patient relationship. It becomes someone you know and someone that you want to help. There's 39 weeks or 40 weeks of pregnancy, and until that baby is delivered healthily, you're not sort of completely relaxed.
Okay, well, gonna meet baby now soon. It's exciting. Sonny will be a big brother. It's a bit daunting. Yeah.
Jenny's baby is about to be delivered in theatre by elective C-section. Having previously suffered 5 miscarriages, it's been an anxious 9 months for herself and her husband.
The fear, it never leaves you at all until you're holding that baby in your arms. It's something that I never take for granted, ever, ever.
I can't wait to see it. Right.
You're trying to push down your hair.
So can you feel any of that, Jenny?
A little bit.
Okay, but nothing sharp, no?
No.
Okay.
It was just kind of overwhelming, that we were going to have a family. It just felt like the possibility of having our family complete. This is more than what we ever dreamed of. We thought we'd be doing really well with 1 baby.
Have it start, everyone, yeah?
So big stretch there, Jenny, okay? Yeah. Big stretch, yeah. Okay then. Okay, follow the pressure. That's it. Well done. Yeah, we have congratulations guys, little baby boy again. There you go. Waving at you.
When I heard him crying, it was just brilliant. He's here.
3.45 kilos.
He's down there, like Daddy. Just kind of no words, you know? Sense of peace, sense of happiness, like. Just can't wait to hold him again.
Oh no.
Everything's perfect, what it knows.
He's gorgeous. You are just gorgeous, look at you. Oh, it's just unbelievable. There's no feeling like it.
It just feels like our family unit is complete. It's like winning the lotto to us.
Welcome to the Rotunda, the longest running maternity hospital in the world and the busiest in Europe.
We're here! Woohoo!
It has seen the birth of close to 1 million Dubliners, and this year, some 25 new babies have been added to that number every day.
Black hair just sticking out.
Hello.
Oh my God.
I know.
It's a place of extreme highs and devastating lows. During the pandemic, one of the most challenging times in living memory.
I'd like to be in there, but the numbers aren't going down at the minute.
We have a date.
It's agony and ecstasy side by side as people experience events which will change their lives forever.
I'd do it again.
Events to be remembered and retold for generations to come.
Pandemic babies. Look at you.
So I'm a firefighter paramedic with Dublin Airport Fire and Rescue Service. I'm completing my placement now as part of my paramedic training to enable me to be competent and confident in the pre-hospital delivery of newborn babies. We attend Rotunda Hospital very regularly. Being based at Dublin Airport, pre-hospital deliveries or near pre-hospital deliveries are very common, and people travelling through the airport and travelling over Ireland who may divert into Dublin Airport because of this pre-hospital delivery that's imminent. Seeing a baby enter into the world for the first time, you're overjoyed that things have gotten to where they are successfully, and you know, we've assisted in that. We've, I suppose, a very small part to play in a big part of someone's life.
Kathy is 24 weeks pregnant. This is the fourth child for her and her partner Darren. They met and got together as childhood sweethearts.
I was 14 at the time and he was only 15. And I knew when I first seen him that I loved him. As childish as I was only a child at the time, but I just fell head over heels for him.
Mary was running the opposite direction.
Yeah, he was having none of it. I mean, none of it. Until we kissed, and then that was it. Kissed.
One kiss.
Up the backs.
And here we are 15 years later.
Yeah, but after that, we got pregnant very young. Like I was 16 when we got pregnant. We done it. Here we are,
Yep.
this many years later, so.
Expecting number 4.
The last.
Oh, but the karyotype isn't back yet. But
They've been referred to the Rotunda from their local hospital, where their 20-week scan revealed complications with their baby girl.
I think we both knew when she was focusing a lot on certain parts of the baby, we knew something wasn't right. And then when she said, I'm going to have to call in a professor, then we both thought like, oh, well, something's going on here. And he came back and he checked and he said, your baby has CDH, it's congenital diaphragmatic hernia.
the stomach is kind of going up and down. You can see a little bit of it here in the abdomen.
He just said, don't Google. That was his words, was don't Google anything, but of course, I Google everything. But we were shocked, absolutely shocked.
What's changed from the last time?
No, I don't think so.
It's a hole in her diaphragm, so her diaphragm isn't formed properly. So it allowed then for her stomach, her spleen, her liver, her lungs, everything's pushed up into her chest. And her heart then is moved over to the right side where it should be more to the middle. So her lung didn't get a chance to go properly.
The next thing is to decide, is this bad enough whereby we would think of referring you out for a procedure, which wouldn't happen in Ireland, where they put a little balloon into the baby's windpipe, blow it up, and then the secretions from the lungs, which should come up and out the windpipe, stay in the lungs and expand the lungs and push everything out of the chest. But because that's very invasive, it has only really been done where things are very critical.
Our baby's not well at the minute. She's not.
No.
No.
But she'll make it.
She will. If she's anything like the other three, she'll be a warrior. So she will, and she'll be fine. Won't she?
You're right.
Yeah, I am.
In the neonatal ICU, Abiba is here to see her twin girls who were born prematurely 2 days ago at just 29 weeks.
I feel like the tube is uncomfortable for them, right?
No, she's sleeping now.
Sorry?
She's comfortable.
She is.
A few months ago, Abiba left her home and family in Ghana to take up a position in Ireland in the healthcare sector. When she discovered she was pregnant with twins, she faced a difficult decision.
I didn't have anyone here alone. My husband is back home. For me, it was a great opportunity to secure a job here. So I was caught up between staying or going back home for the support. And then in the midst of all of that, thinking of what to do next was when the babies came. They had to bring them both out immediately.
Is she crying?
Yes, because when I touched her.
When I see them crying, I'm like, do they cry? Because I feel they are so tiny. They haven't reached that stage. So everything seemed strange to me. And I would get so emotional. I felt they were too tiny to be going through all that they were going through. It's too much for them. I felt like it was too much for them. And it made me have this guilt. I think it's more of a motherly guilt that I brought them into this world, and look at what they are going through. Look at how much they are suffering.
The twin sisters, named Mardia and Radia, will be cared for in the NICU until they reach full term.
It has been a tough moment for me. Like, I would say this is the toughest thing I've ever experienced in my life. To be in a country that I know nobody.
So the Rotunda is the oldest continuously operating maternity hospital in the world. It was founded by Bartholomew Moss in 1745. It's a very old building, so at the moment there's some renovations happening in the front hall of the hospital, and they're lifting some flagstones in the front hall. So we're hoping to bury a time capsule under the flagstones to give a flavour of what's going on in the world at the moment, stuff and vaccines, and we gather some mementos of what it's like in 2021 in the Rotunda. It's very ad hoc. He's digging up the floor. Would you fit a time capsule on there? Yeah, loads of room. Someone can dig up with this film maybe in 100 or 200 years' time and see what was going on in the summer of 2021.
So do you have your flights booked?
Yeah, for Monday morning, 6:30. Mom's gonna come with me because we need somebody here with 3 other kids, so we need stability for them. So yeah, Mom's gonna come with me for the time.
Now 27 weeks into the pregnancy, Kathy and Darren are back with Professor Daly, who has estimated that if they do nothing for their baby, there is a 66% chance that she will die shortly after delivery. However, an opportunity has arisen to see a specialist in Belgium in the hope of increasing the baby's chances of survival.
We got a call on a Tuesday from Professor Daly to say that he was getting in touch with Professor Jan de Prest, who is the top man for feto in Belgium. And he rang us on the Tuesday and said, look, we want you to go over for a consultation.
And you have an appointment for Monday.
You have an appointment for Monday. Literally, that's how it went. Then on the Thursday, I had no passport. So it was a dart and a dash.
She's practicing German all week.
It's not German they speak though, sure it's not.
I said,
No.
I'm not practicing, that's what Mom said, I'm fluent.
So they speak French and Flemish, I think, don't they?
Flemish. I'm a bit Flemish this morning, yeah.
So the baby's head is here.
Okay.
So you'd expect to see the heart down here, but the heart's actually up there.
Okay.
Okay, so the heart, as you know, is
to the
pushed to the right, and that's because the stomach is up. Now, most of the liver, I don't think, is in the chest.
If the Belgian specialist decides that a procedure is viable, he can attempt to insert a tiny balloon into the baby's air tract, giving the lungs a chance to develop naturally in the womb. But this is risky.
The difficulty is that putting instruments into the womb can cause the membranes to rupture, can cause the womb to contract, and premature labour happens frequently. If you look at the trials, it happens in almost half of cases. And if you go into labour early and deliver the baby, and there isn't somebody there who's trained and capable of taking the balloon out, then the baby dies because it has a blockage in its breathing tube.
If the procedure goes ahead in Belgium, Kathy will need to stay close to the hospital there for up to 6 weeks in case she goes into early labour.
Because we, in our heads, knew that if we went to Belgium, this was the place we could go to try and help her. That was the easy decision. But then when you're looking at everything around it, like the fact that we have 3 other children, the fact that financially, yeah, being able to try and get money together, I mean, like there was a hell of a run around. Darren had to go in and get money out. My dad got money, my uncles, aunties, everybody supported it.
I don't know, it's a lot to take in for you.
And it's sad,
Not being able to go because both parents can't be away from the kids for so long, which means the other parent has to go through it on their own.
We have a 1-year-old at home and she's still only learning everything, so it's heartbreaking knowing that that I'm leaving my family. But I know it's for the greater good.
We get through it.
Yes, we will.
She will make. That's the wee warrior.
I have to be positive and I have to think ahead, and I am thinking ahead that she will be here and she will be okay, and we have a fight ahead of us, but we're prepared for it. We're ready. We are ready.
In the neonatal ICU, twins Mardia and Radia are making good progress. And Abiba is already wondering when she'll be able to take the babies home.
The next challenge is to get, I think, Radia back over the kilo mark, because I think she went under the kilo.
Yes.
But they're handling beautifully. They're doing everything that we want them to do. Yeah. So, really pleased.
Happy.
Yeah,
I'm pleased, yeah.
In
terms of looking after a preterm baby or a very preterm baby, whether I like it or not, girls are definitely stronger than boys. And there are studies that show that girls of an African heritage are stronger again. So it certainly was a joke or a laughing moment for myself and Abiba when I was chatting to her that she has the strongest of the lot.
Abiba is being discharged today. Although delighted with the twins' progress, she has to face leaving hospital without them.
When I was being discharged, I felt that I'm leaving my babies behind. That is not what mothers do. Mothers are supposed to take care of their babies. They're supposed to be there for their babies. They're supposed to be there when their babies are crying. So going home and leaving those babies there was very emotional for me. It was very hard for me. This journey has been the hardest ever. Ever.
Kathy is 28 weeks pregnant. She's arrived in Belgium where the specialist has agreed to attempt the procedure today, in the hopes of increasing the baby's chance of survival from just 33%.
I still get nervous from this, still, because you always know what can go wrong. I say he to every baby, yeah, so I don't even know if it's a boy or a girl. It's a girl, yeah, I'm sorry, yeah.
The team will make an incision into the womb and with the help of a camera, attempt to enter the baby's mouth to insert a tiny balloon into her windpipe. They hope that the procedure doesn't bring on labour.
So I was awake for the surgery, but I could actually see on the camera screens exactly what they were doing.
The balloon is in here. That's what it is. This is handmade.
To see them actually place the balloon, because it's in utero, it's in your belly, like it's something, to me it's unheard of. I never knew this was possible. But to actually watch it and to watch it happen in our baby, it was like an out-of-body experience.
Probably on the lower lip, I hope here, is the mouth opening. Should be straight in front of you. Can the mom see it?
Yeah.
In the windpipe, I think. The tail of the balloon, that's where you pull on later on. That's it.
That was incredible to watch. It was incredible to watch. Yeah.
Just 1 hour after the procedure, Kathy is experiencing mild contractions.
But they will give you an extra one. How does the next 24 hours look like? I mean, staying here, this is surveillance against contractions.
Yes.
And she has a bit, because the womb doesn't like that, so it should go away.
But you're happy that everything went
So far, so good, I always say, but
yeah.
One step at a time. What can go wrong is membrane rupture and delivery earlier than required.
We were ringing every night. We got our prayer to St. Jared.
So we done that as a family every night?
Every night the phone call was made, the prayer was said, the candle was lit.
We were just thinking like, please let it have worked, that we're not doing this for nothing. Our proper chance is starting.
The fight had started.
Yeah.
And we are, you're still at the front.
She is.
Still leading the pack.
Abiba has been discharged from the hospital after the birth of her preterm twins, Mardia and Radia. She's been expressing milk for them and has been able to visit for up to 8 hours per day. But now, without her husband or any family in Ireland, a juggling act lies ahead.
Radia is going to be discharged first, and then Mardia will follow, and I don't even know when. So bringing Radia home and leaving Mardia here is hard. And I can't leave Radia home and come and attend to Mardia here. And I can't abandon Mardia here because I'm home with Radia. That's a conflict for me.
Fortunately, the twins have not suffered any significant side effects of being born premature. However, all preterm babies need to have an eye test to rule out any damage to their sight.
Years ago, when we started getting very good at intensive care for newborns, especially preterm babies, we were seeing quite an awful lot of blindness in graduates from neonatal units. And we figured it out over a number of years that this was related to the amount of oxygen that they were getting. So we gave them the amount of oxygen that they need, but we also screen their eyes regularly, which is quite a tricky procedure that the ophthalmologists do to look for any overgrowth of these vessels at the back of the eye.
Well done. Well done, sweetheart.
To have both of them home, I see that as a dream, going on with our normal lives, and know that there is nothing going to happen next. There is nothing we are going to think about, we are going to be worried about again.
Oh, she's doing great.
All right.
Thank you very much.
Hey, good to see you. In you come.
6 weeks after Kathy's procedure in Belgium, the doctors there have successfully removed the balloon from the baby's air tract. She's now 34 weeks pregnant. Today is Professor Daly's first chance to see if there is an improvement with the size of the baby's lungs.
Yeah. You can see the colour difference. You see, like, obviously it's all shades of grey, but...
Brighter now, so it's more easy to see.
Yeah, gosh, that's very impressive. And let's just keep our fingers crossed, you know.
We asked Professor Daly what was his take on percentage of the baby living, and he gave us a 60% chance of survival. And 10 minutes later, when we came out of the room, we were sitting in the corridor, and I just says, I wouldn't even be listening to that. Our wee woman's going to be with us very soon.
Yeah, that's where Darren's positive and I'd be more realistic. So I see the percentage, but it's not a coin toss of a 50-50.
Yeah.
We're on the better side of that now, and hopefully we stay on the better side of that. Hopefully.
I'll be able to say at the end of it all that I tried and done everything I could for her. So that's the main thing. Whether it be 6 weeks or 6 months, I know now that we done everything we could on that end.
There's nothing else you could have done.
They have embraced all of this difficulty, and I would say they are both very optimistic, glass half full kind of people. And I just really, really hope it works out, you know.
For dads, this has been a really difficult year. They haven't been able to attend the antenatal visits. A lot of times they haven't been able to attend scans. So I know a lot of them have said to me that they felt that they didn't connect as well as they might have done with the pregnancy. Fathers nowadays are much more connected and much more hands-on than fathers of previous generations. You'll see them encouraging their partners when it's pushing. They want to cuddle the baby themselves. And because their period of time in the hospital has been very limited, that has been hard on them.
It's been 10 weeks since the birth of Abiba's preterm twins. Today marks the end of what has been a very difficult juggling act. Her husband Raheem has arrived from Ghana, and now their second girl is healthy enough to be fully discharged.
I wasn't sure of the outcome. I wasn't sure of how we are all going to handle this, myself and them as well. But they made me realize what a strong woman I am. I feel that if you're not strong, you can't do this.
It's Mommy. It is Mommy. How are you?
Hello, Princess.
Marty and Radia have had an excellent course through the neonatal unit. They've required very little support from us. They've been little rock stars.
See, I'm in whites. I'm in all whites, and my husband is in all whites as well.
And what does that mean?
Victory.
Yeah?
Yeah.
Very good.
Yeah.
Well, she's been at the hospital for more than almost 3 months now. So when we got the news that she'll be discharged today, we were very, very happy. Very happy and very, very excited. And her sister as well can't wait to have her home. We all can't wait to have her home.
This is for the girls and for getting through their NICU journey successfully.
Thank you, us. Thank you so much. Bye. Thank you.
I'm going to tell them the story. I'm going to make it an interesting story, not a painful story. I want to remember and talk about it as what a strong woman having strong babies went through.
Hey, Marty. Daddy's here. Daddy.
Lauren and her husband James are expecting their second baby.
It was a bit crazy that we'd have, I think Thomas was only gone one when we found out I was pregnant again.
You're only moving into our house as well.
Yeah, we just bought a house. So we were just moving into that, found out I was pregnant. And then it was maybe when I was 14 weeks,
Yeah.
we found out about the cancer. So then it was just a different level of panic at that stage.
Results from a smear test revealed abnormal cells, which when further investigated led to the devastating diagnosis of cervical cancer.
When we got called in from the results from the biopsy and they confirmed it, it felt like our world was shattering.
Yeah.
Because obviously, with the pregnancy as well, you didn't know what was going to happen.
I think the first thing I actually said when they told me it was cancer was, am I going to die?
The couple had an initial discussion about their options with a consultant gynecological oncologist and then faced the heart-wrenching dilemma of what to do next.
At that time, they discussed the options with her, which included surgical treatment, which would be one of the mainstays of treatment for this stage and type of cancer. And that would have involved termination of pregnancy to proceed with the surgery.
The thought of leaving our son without a mother was killing us. Well, it wasn't an easy decision to make. It really wasn't. It tore us apart.
Sounds great, doesn't it?
Lauren and James then got a clearer picture when they spoke to a consultant gynecological oncologist who had a similar case to theirs before.
He actually had a patient, I think 10 years ago or so, wasn't it, that had the same thing, the cervical cancer during pregnancy. She did the chemo and she delivered the baby and then...
They're fine, they're perfect, they're healthy. When we heard that, it was like, brilliant.
That's a no-brainer.
That's a no-brainer. So he recommended 4 or 5 rounds of chemotherapy with the baby being in the womb, and then the placenta there, it's acting like a shield. This is the way it was explained to us. So when she was getting chemo, the placenta was taking the hit. So it was filtering out all the bad stuff.
Hi, how's it going? How are you? Everything was stable over the weekend? Yeah, good. So I'm just going to have a look myself.
I think it was 2 weeks after I had the first chemo, my hair started falling out. That was actually really hard. I didn't think it would be.
Of course it was going to be hard. You're a woman. It's your hair.
I know, but my hair wasn't. It wasn't a thing.
It was your hair.
Like that's when you're like, okay, I have to wear a wig or I have to wear like a headscarf. Like that's when I really started feeling like I look like a sick person now, because until then, well, I don't think I looked too bad.
You still don't.
But, cute little face there.
Just like your mommy.
Yeah.
Every bone in my body was just aching and sore. I couldn't walk up or down the stairs. Felt like my ankles were going to snap or something. But I think the worst part of that was then realising that Like when I couldn't lift Thomas.
Yeah.
Just I felt so weak from it that I didn't want to risk lifting him down the stairs and carrying him just in case something happened.
Any idea what she be weighing at?
So what did we say last Friday?
She was 3 pounds last week.
3 pounds last week.
It was after the second cycle of chemo. They noticed that she wasn't growing as well as she should have been.
1.3 kilos, so just under 3 pounds. Yeah, so probably in and around the 3 pound mark, I would say. Yeah. The baby's growth isn't what we would hope, and so we have to plan a slightly earlier delivery because we know that at the time of birth, not only is Lauren going to have her baby, but also she's going to be undergoing significant surgery for her cancer, and this will involve a hysterectomy and very extensive dissection of her lymph nodes. And so if she requires an emergency section, it won't be possible to optimally treat the cancer at the same time. So we want to very much avoid that.
The baby will be delivered early, at 31 weeks, under general anaesthetic.
So if you think of that's your womb, and then that's the bottom end and the top, that usually it would be along here. Because that's close to the cervix, they would try to, and even though they do need to do a lot of dissection around that area, they're going to do it higher up incision. Yeah.
Okay.
Grabs.
That's okay. Never just came down.
Count downstairs.
Yeah.
Kathy and Darren's baby girl has made it to her due date. Kathy is fully dilated and ready to push.
To see that she can stay this strong with everything she's after going through and still has to go through for our fourth baby. I absolutely adore her for doing it. And the love I have for her is definitely more and more now than it ever was before.
The neonatal team are on standby to intubate the baby at birth in the hope of beating the 40% chance of her not surviving.
So normally when a baby is born, they take a breath and their lungs gradually inflate, but they also swallow a certain amount of air into their stomach and into their intestine. And with the diaphragmatic hernia, that's a problem because the intestine is actually in the chest cavity. So it's important that we intubate these babies as soon as possible after they're born, and that if preferably before the baby actually cries at all, if we can.
Look at the hair. Can you look down? Do you want to see her? Look at all the hair. Oh my god. Wow! Happy birthday! Birthday 10!
Look. Alright. You cry.
Oh, she is a cutie. Now.
Wow.
That's very brilliant. I think
Get the level
yeah.
Level of it. Get the colour change there. Good.
Yeah. That's 41%. Well done, guys.
She's breathing on her own. Now the reason she's gone quiet is because when you put it through your vocal cords, she can't cry.
Yeah.
So that's a good sign.
She's breathing on her own.
Yeah, no, she's breathing on her own. We are helping her breathe, but she's also breathing herself.
Yeah.
Well, she'll give a little bit of help.
The intubation is successful, so now the baby can be brought straight to NICU for further assessment.
We've got an incubator outside the door, so we're going to move her over to the intensive care.
Okay.
Yeah, we'll see how it goes.
Very good. I see. Yes, that's like
The 3 kilo baby we're saying, isn't it?
About 3.
Just minutes after delivery, Kathy and Darren's baby is responding well in NICU.
The chest x-ray shows a very large left diaphragmatic hernia. There's a lot of Sadie's stomach is in her chest cavity. You can see her stomach because that's the area where the tube goes into. But despite that, there's a reasonable volume in her right lung. With a diaphragmatic hernia of this size, the baby will be extremely sick in large amounts of oxygen and on high pressures on a ventilator, whereas in fact Sadie Rose was quite easy to ventilate and she was in 40% oxygen, which is, it's extra oxygen, but it's a small, it's not an awful lot compared to most babies with diaphragmatic hernias like this.
Can you see it?
Look at that. That's so beautiful. Oh, she's so tiny.
She's displaying great signs and is breathing successfully.
Look at her. Oh, Kathy, she's just gorgeous. Isn't she, Mommy?
We think the transport team will probably be here before 5.
The National Neonatal Transport Programme will shortly bring Sadie Rose to CHI at Crumlin, where staff there hope to repair the hole in her diaphragm that has caused all of her problems.
Right. And can we find out the visiting times and all that, or will there be visiting times?
I think if somebody's in intensive care, they'll let you in this evening anyway,
Right, okay.
Seeing your baby being born and then having to be rushed away, kind of preparing for that, I don't think anybody can. That'll be in the moment kind of thing.
Yeah, I know.
It's 11 p.m. Chinese national Longfen has been admitted to the hospital, to the prenatal ward, in early labour.
去医院的那个晚上，其实是挺无助的，因为疫情，去医院只能一个人，然后他没有陪着我，总觉得不是很安心。
Longfen doesn't speak English. Until it is time for her husband to be able to join her, staff will use the hospital phone translation service to communicate with her.
We were communicating through the notes that we had, through body language and the phone. We were able to use the phone initially to get some information.
Just 3 hours after being admitted, Longfen's contractions are now strong and regular. Now her husband Dong can be with her until after the baby arrives.
Labour this is established labour, so you're going to have a baby today.
Oh yeah.
Just what time I'm not so sure, but look, we'll work that out.
Yeah.
I think the first thing to deal with is the pain.
Yeah.
Whilst you can do a lot with body language, and body language says a lot more than you think, yes, verbal communication is very important for our job. You do, and I do, but you don't. You can take the mask off.
我们来爱尔兰10年了，然后我老婆她来了3年，她一来我就认识她，去接送她，然后有3、4个月之后，我就跟她谈恋爱。
然后去海边散步，然后我们就慢慢的一步一步的谈恋爱。
我们中国人会比较害羞，慢慢的没有明白的表达心意，但是慢慢的让对方感觉到我们是怎样子的为人，然后慢慢的让他懂得我的心，然后我们慢慢开始谈恋爱。刚开始我认识他的时候，我比他大8岁。 从一定的意义上来说，我觉得他的思想文化会跟我会有点不一样，会有点小女孩的性格。
我知道的呀，可怜了，小妹子好可怜啊。
在内心深处就会喜欢一个人，也就会接受他的这些小的这些缺点，而且慢慢随着他长大，我觉得他会是一个好老婆、好妈妈。
他年纪比较大一点，感觉会更疼人，然后更稳重一点。
小林子啊，好勇敢啊！
大哥。
Yeah, it's fine now. Yeah.
手给我扶着脸。
You did fantastic. Absolutely wonderful. You'll have a morning baby. That's what we want.
Yeah, thank you.
Nice, gentle delivery.
出来的时候，星星还在吗？
睡着了啊，睡着，你不用担心，星星睡得好好的，2个阿姨找我呢。
第一个小孩他比较活泼可爱。
And your baby at home was 1.5.
Yeah.
Lovely.
因为我年龄比较大，30几岁才有小孩，所以当第2个小孩来的时候，我当然是很期待。
So now we need a progress report to tell us if this baby is coming out today or tomorrow.
Oh yeah.
Joking. Today.
Should be today.
It'll be in the morning time. Maybe breakfast baby, what?
他说他跟你开玩笑。
直到那个宫缩疼痛来的时间越来越短，越来越痛。
啊，小林子太辛苦了啊。
No, my dear.
明年带你回国啊。我知道不生了。
真的觉得无力，你也在身旁，你帮不了他。
Excuse me, why she feel cold and shaking?
The labor is very powerful.
应该要让男的也去体验一下生产的这个痛苦，然后怀孕、孕期这个各种不舒服的状态，让他们体验一下，其实怀孕也是不容易的。
好，小林子，老公在这，我在这，你这怎么了？啊，这有点不对劲啊，这怎么了？
This morning in the Mater, Lauren and James's baby has been delivered by C-section at just 31 weeks.
Penny was delivered. It was 10:30 in the morning. She was being transferred straight off to the Rotunda. The ambulance came and collected her.
Lauren is still under general anaesthetic for further surgery to have a full hysterectomy. The National Neonatal Transport Programme resuscitated and stabilised Penny when she was born and is now transferring her to the Rotunda ICU.
Admission, translator.
When Penny arrived from the Mater Hospital, we were expecting her to need help with her breathing because of her prematurity. She was suffering from what we call respiratory distress syndrome. She came in ventilated on a breathing machine, and we had to give her a medication, and she actually had a great response to that.
Once he got word that Lauren is out of theatre, James left the Mater to come down to the Rotunda to see Penny.
Hey, John, you okay? Yeah, just going up to see me baby. Transferred there from the Mater.
So where's baby up in the NICU, was it?
NICU one, yeah.
What's the baby's name?
Penny. Oh, the head is all over the place, but obviously Lauren's up in the matter, so it feels like, yeah, with the two hospitals, you know, it'd be good if I could turn myself in two and be with both of them. She's so small. I know I'm not. Thank you.
My name is Carol. I'll be looking after her today.
Thank you, Carl. She's so small. My head is still in the matter with Lauren. I just want to hear her talk to me. I know she's gonna be fine, but I know when she wakes up, she's just gonna want to be here.
Look, this could have taken a turn for the worst.
Yeah.
But we're beating it, and we're gonna have a little girl at the end of it.
At least we did have something to focus on. I actually don't know how people would do this without.
I don't know how you done it while you were pregnant. So you keep saying to her, like, champion.
If it wasn't for you, like, I wouldn't have survived it without you.
Yeah, sure, look, this is what we have to do. I'll always be there. That's what I married you for, sickness and health. So I kept saying
But
to
it
you,
wasn't
kept
meant to
saying...
actually happen.
Hey, yeah.
Lauren will have follow-up tests to assess her recovery and to determine if she is cancer-free.
Now that Penny's here, I don't know, it just makes you feel a lot less stressed. But if I need more treatment, that has to be done. So we'll just get on with it, really.
We're at the end of it.
Yeah.
Been through enough.
Yeah, we're due a bit of good luck.
Exactly. So we have our lucky Penny now.
Yeah.
And she'll bring you luck.
要睡觉。
一个人睡觉了没？一个人睡着了没？
Are you ready to have a baby?
他
Happy
说
days, this
你
is
准备
great.
好了，小孩的。
I'm ready to see this baby. I want to see this lovely lady. The epidural has helped a little bit, but I think sometimes it's just time to get on and have a baby. And that all we're doing now is waiting.
Her body was very, very, very much in tune with what it had to do, and did it very well.
Go on, big breath. Hold and push. Push down and down this way, down into your bottom. Yes, that's good. That's a good one. And let it out.
痛的我感觉我从来没有经历过这么疼痛的感受。
偷偷看到啊。
Baby's here.
Yeah.
啊，我感觉真的要崩溃了，太难了。
Okay,
小林子
if you have the
加油
feeling, go with it. Go with
加
it.
油，小林
Oh,
子，小林子加油！哎呀，厉害，小林子啊！
中国有句话说得好，为人母则刚。想当妈妈，我觉得真的是付出真的是很大，然后。
You're doing okay, Lynn. You're doing fine.
出来了，出来了。
5 o'clock. Give me one more push. Hello.
Oh.
Hello.
生了，生了。
Hello. 5:01 in the morning. One beautiful baby. One beautiful, beautiful baby. Well done. Look what you did.
小林
You
子
did fantastic.
看到他的那一刹那，我感觉我运气所有的不是都是。
Happy baby. Happy mama. Now let's dry. That was so quick. Very good. You could be booked for speeding. You went so fast.
有。
你好
你会感觉，哇，你有很多期待，你想要给他好的生活，你想要对他给他很多的爱，多陪伴他。
怎么有鼻涕吗？有没有？
没有，不要擦，不要擦，太热，不要擦啊。
These babies who will be around long after I'm gone. and filling up the Irish football teams and rugby teams and running the country and the leaders of tomorrow. When I'm on my pension, they'll be paying into that into the fund. Your next baby will be 4 kg.
My girl said no more baby.
Okay.
再多一个男孩，那你不想要吗？
精神精力什么都不够，我觉得有2个小孩已经足够了。
但是有一个男孩的话，对于中国人的思想来说，确实女孩嫁出去，可是男孩一直陪在身边啊。
我不喜欢。
OK。
完成了，不生了，好不好？
Welcome to the Rotunda, the longest running maternity hospital in the world and the busiest in Europe.
We're here! Woohoo!
It has seen the birth of close to 1 million Dubliners, and this year, some 25 new babies have been added to that number every day.
Black hair, just sticking out.
Hello!
Oh my god!
I know.
Since this series started filming in 2017, some 35,000 new Irish citizens have been born here.
Hi!
In this episode, we revisit some of the families we met.
This don't feel good.
It's coming out. You don't want the baby to come out and fall on the ground.
Happy birthday!
To find out what happened next. Back in 2019, Jing and Christy arrived into the delivery suite at the Rotunda for the birth of their first baby.
We met online,
We
actually.
actually met on a dating site, yeah.
Yeah, it's online. It's like
Asian.
15 years ago.
15 years ago, yeah. And then we just went to the cinema then. And
Yeah, it was nature, yeah.
Yeah, it just
nature,
clicked
yeah.
straight away kind of thing, yeah.
Yeah.
How was the pregnancy then? Did you find it hard or?
We didn't know, she was 12 weeks gone, we didn't even know.
Stop.
We tried nearly 10 years.
Trying, yeah,
Oh,
so her cycle was
right.
not regular. You thought you were gaining weight. She was actually in the gym, working out, and she brought like this fit belt because she was putting on a bit of a small belly and she was
Yeah.
like pumping iron in the gym. And she came home and I was saying to her, she was saying, she's getting very chesty. I said, I
Yeah.
think you might be pregnant. I said, she said, no,
I
it
said,
can't
no
be.
way,
She said,
can't
no,
be.
no,
It's
it
not
can't
yours.
be. I said, I said, I think you are. So she actually just went into the toilet and tried. Actually got your pregnancy test kit in the Euro shop.
€1.50. I didn't spend too much money for my kids.
So she tried like 3 of them, and then they were all positive. First thing I heard was a scream.
I was like, Gracie, come here! You know when I opened my mouth?
You're in trouble. This is good. I was waiting for this.
After a few hours in labour, Jing had decided to get an epidural.
Well done, Jing. That was
super.
Brilliant, yeah.
I thought after epidural, the baby come out automatically. I swear to God. I thought after, great, just lay down there, probably baby come out because 10 fingers open already, she come out. Eventually, I just relax a bit.
Big deep breaths, well done.
She had progressed really fast. We would expect people to go a bit more slowly, especially on their first baby, but Jing bombed it from when she came in.
Keep going, keep going, keep going, keep going. Big breath in and big push down again, Jing. That's it.
Oh, brilliant.
Well done.
Super.
Keep going, Jing. Well done.
Jenny told me we'll be taking average 1 hour and 1.5. I was like, oh my God. I said, no way. I said, no way. I do my best. I will do my best.
Well done. You're doing great. You're doing great. Great. And one more push if you have it.
That's it.
Big strong push. That's it. That's it. Keep going. Keep going.
I was actually looking at her head, and her face was going really purple, and I was going, oh my God, strong woman there. And you just see the willness in it, just to, the fight you could see in her. Yeah. Same.
I don't want the baby suffer,
fair play. You're doing great, jeez.
Yeah. Doing big breath in and a big push down. Well done.
That's it.
That's
She's
it.
nearly out now, baby.
And
She's
breathe.
out.
Oh, and breathe.
Wow.
Hello, lovely.
Wow.
Now, Baba. That's 1424. Let's give you a roll. Hello.
Oh my God.
It's okay, it's okay, it's okay.
What am I doing today?
It's okay,
She's perfect.
it's okay.
Hello,
She's just...
lovely.
Oh my God. She look like me.
Yes.
Hello, lovely.
Gorgeous.
Oh my God.
Now, lovely.
Oh. Hello, Millie. Hello, baby.
Millie.
Talk to Mom.
Millie. You best girl. Mommy love you, baby. Oh my God.
Thanks.
Little Bobby. It's okay, Millie. It's okay. Daddy and Mommy. Millie.
We were wondering what the mix would be like, obviously,
Yeah,
I knew it would be dark
eyes,
hair.
yeah.
I was saying it would be brown eyes, and she was now blue. And she was like me, saying, you probably have your lines on your forehead, or your freckles.
double chin.
Or your freckles, or your double chin.
She got everything. Birdie doesn't get everything.
She got a mix of both.
Oh my God. It's like Daddy's hat.
Big hands.
Oh my goodness.
Mommy's little nose, cutie little nose.
Oh my God, my nose, Jesus.
Why?
Bottom nose, no nose.
Stop.
She now look like Daddy at all.
I don't know. It's like mission complete, isn't it?
Yeah. Mission Impossible.
Missing Tom Cruise.
Yeah,
I'm not Tom Cruise.
Daddy's okay. And now I have to learn how to be a parent, for me. I don't even know how to change a nappy. I swear to God. Millie's full of energy. Love to risk. You love to take risk. No problem. Constant go.
Bubbly and yeah.
She's just go. She doesn't like to have a rest or just relax, chilling. No, she like to do her things. Very cheerful girl she is. Yeah, compare Mama. I'm off smoothie anyway, so so a different personality. And she take her personality from that. Honest with you, definitely she is a little average girl. She's a little average Colin.
She'd be Daddy's girl, yeah.
Daddy's princess.
Will you be more strict?
I'm more strict. Yeah, more strict.
If I come home, she says you bowl all day, or behave yourself.
Yeah, she have to. Otherwise, I'll be like this in the bomb on the bomb. If I had a bad day, you can see my face that she dropped. And she's like, Dada. Oh.
Save me.
Yeah, save me, please.
I'd just say that if she is bold, you speak to her in Chinese, so I can't understand.
Since having Millie, Jing has graduated as a qualified accountant.
When Millie born that year, That was my final year in my college. I was doing my finance accounting degree at that time. Sometimes I have no energy. When you're really low mood and after you give birth, your body is in bits and you just no energy. But you have to tell yourself, you can do that.
You're stronger than you think.
Yeah, you have to believe yourself. It's strong in your mind. And I can see I did really well. I get 2.1, and that's a huge challenge for me. It's huge achievement. I want her in the future, if Millie can say from her mama, look, my mom can do this in her age, in her that late 30s age, and she can do anything as well. That's a model. That's a role model for her.
Yeah.
Have to be tough, girls.
Jing is certain that she has no intention of having any more children.
Oh, you actually said, would you like to have another?
No. I'm done.
Listen, we're
I'm
of
40 years
age
old,
now,
thank you.
so I says, listen, we have one, we're blessed with that, so listen, we just...
Don't get greedy, come
Yeah,
on. I have to say, we never really fight for the last 10 years. We were together, married 10 years, never had a fight.
Never really.
Since I had meet,
easy going,
I constantly fight like that, constantly. He take loads of shit from me, honest with you. I'm a bit selfish, honest with you, I'm a bit selfish. I look after myself first. I have to make sure I have my hair done, my makeup done before me to get dressed.
Yeah, I'll be like the last minute. I'll be like a woman.
You,
I'll be the last minute.
Forget about that.
Getting everything
Are you
ready.
ready, Christy? Go.
And she'd be going, are you not ready yet? And she'd be glammed up and I'd be like, look beside me.
It doesn't matter, you're not important. You only carry the bags.
Exactly, yeah. You do it.
2 years ago, we met Stacey Jean and her husband Alan in the Rotunda. When they first met, they had their eyes on a different prize.
We met back in 2010 at the Ladies' Day of the Triplet races. So we don't count the day at the races as our first date because it was only kind of towards the end of the night that we realised that there was a bit of a spark there.
Yeah.
We had our first kiss that night.
Yeah, you were trying to set me up with your best friend.
I was trying to set you up, but it doesn't really set a romantic tone when you're trying to hook you up with somebody else.
He was very confident.
Some would say overly confident.
Very confident and funny. He was very, very funny, to be fair. Very early on, I think, we discussed a family and said we realised we wanted the same thing, we had the same morals and that, and we wanted children, both of us kind of did.
We just expected that we'd get pregnant pretty quick and like everybody else that we'd get married and maybe go on honeymoon and, you know, conceive there, have a baby and, you know, 9 months later. Yeah, right?
Yeah.
You sure?
Yeah.
The couple soon became aware that Stacey Jean's previous medical issues were affecting her ability to conceive.
Growing up in that, I always had stomach pain and that, and then my appendix burst and destroyed one of my fallopian tubes as well when that happened. So we knew there was going to be some issues, we just didn't realise there was as many issues.
Over the next 5 years, Stacey Jean had multiple pelvic surgeries, followed by 3 IVF treatments to try to conceive.
It's a cool world out there, you know, if you can't have kids. We were at a wedding and I remember that Stacey's sister-in-law was asking just routinely about how everything was going and with the IVF and everything. And it took me a while before I realised that I kind of twigged with me that she might be pregnant. I thought she was kind of testing the waters just about how she'd break the news. Like, they were very apprehensive about telling us. And they told us and we were delighted and we were so happy for them. We really were, and we hugged and we kissed and everything. And later on that evening, I remember, and I'll never forget it, we went out for a dance on the dance floor. And suddenly we just looked at each other and we were both crying. And everybody else was happy, and it was real kind of like a surreal moment where it was just the two of us. And we could have been on the dance floor on our own at the time. And I remember we said to each other, look, we'll give each other the rest of the dance. We'll cry and we'll hug and nobody will notice. And then when the song is over, we'll clean ourselves up and we'll go back and everything will be fine. And we did. And we were delighted. Like, we were delighted for them, but we were sad as well. You all right? So, but yeah, you okay?
No worries.
At last, after almost 5 years of trying to have a baby, their 3rd IVF treatment was successful.
3 o'clock in the morning, I was woken up to a positive pregnancy test. You're meant to do it after 2 weeks. Stacey never waits the 2 weeks.
Very hard.
We were delighted, and I've never seen a happier pregnant woman in my life. Stacey was just so happy.
Yeah. But I still don't think I'm letting myself believe it until I have the baby there and everything is okay.
You might feel a bit of a stretch.
Yeah.
Okay. You're okay. You're up 3 minutes. Just keep doing it. Out 2 minutes. Okay.
Congratulations.
Let's see what have we got first. What have we got? It's we're right. Congratulations, both of you. You have it.
It was worth it all, wasn't it? We were so blessed just to get pregnant with the IVF and that. We had pretty much said that that would have been our last round, and thank God we did it when we did it, and it worked.
Their little girl, Alana Jean, is now 2 years old. Soon after she was born, Alana Jean became very unsettled.
When she was born, she cried and she didn't stop crying. I knew from day one that she wasn't right in herself. After a few weeks, she was losing weight and wasn't able to eat properly, and her body was getting smaller and her head was getting bigger. And she was just uncomfortable, and anytime she'd cry or something, I was like, there's something wrong, there's something not right. I don't like the way she is like this. And at the beginning, everyone's like, no, that's normal, that's babies, that's the way babies are. And I was like, going, no, there's something wrong here, this isn't normal. I wanted someone to listen.
To be honest, I wasn't probably as supportive as I should have been at the time. I was of the opinion that babies cry, and that this is what it is now. I remember back 20 years ago, my sister had issues, and my sister had issues and colic and that, and I was kind of just putting it down to that kind of stuff.
No?
What do you want to do? What do you want to do?
Stacey brought her into the doctor one day, and you could see it on the chart that her head really was getting a lot bigger, than it should have been. I could see the worry in the doctors a little bit, which was a big cause of concern. She struggled to feed, she wasn't putting on weight.
Say hi, Granny. What's the swings? You see some?
She had issues with her feet as well.
Her body's hypersensitive, so any touch at all upset her and gave her pains like pins and needles all over her body. Muscles didn't react when she was born, so she wasn't able to move her hands and her legs, so she wasn't able to hold herself or anything. Literally from her head to her toes, there was an issue with something.
At 10 months, some of Alana Jean's issues were discovered to be related to a severe cow's milk allergy. A medical team has helped her since the diagnosis. Her diet was changed, and now Alana Jean continues to thrive.
Once we knew and learned what it was, then we learned to work with it. She's thriving, she's happy, she's so happy. She's a mini Alan, so she is in every way. She looks like Alan, she walks like Alan.
She does have a big Burke head in her, to be fair to her. Like, we couldn't have asked for better, and I know every parent thinks that, and they're like, oh, our one is more special than everybody else's, but she is more special than everybody else's, Like, oh, I don't want her to be, don't grow up full of herself, but she definitely will be, because I tell her every day that she's amazing. It's not just that she looks like me, she is a gorgeous little thing.
Everything has been fulfilled. I've had everything I wanted, my dreams, and more have come true.
Just the three of us, it's like our own little team now.
The second pregnancy would be a bonus, get to do everything again. I can't even let myself think like that. But yeah, at the moment,
we're happy. Yeah, we're happy.
You had a cesarean section before?
Yes.
Okay.
In 2019, Sinman came into the hospital experiencing a lot of pain at just 35 weeks pregnant. The doctors were concerned about the baby, so decided on an emergency delivery by C-section.
I told them about a stitch I had this morning after breakfast, and just as a precaution, they're afraid that the uterus might be kind of weakening.
Have you got somebody coming in with you? No, just me.
Her husband Ian was on the other side of the world, on a business trip in Miami.
Yeah.
I flew out on a Sunday and I woke up to a text on the Monday it was when you were getting all your scans and stuff done, saying, guess where I am? And it's like, what?
Great. So we're just going to let that dry, okay? And whenever that's dried, then we'll cover you over, then we'll check again. We were just chatting about the scar, and we're going to go through the scar that Oscar was born through, okay?
2.5 years ago, Simon and Ian had their first child, Oscar, who has the fetal abnormality spina bifida. This affects bowel and bladder function and can leave the child with little or no ability to walk unaided.
It never occurred to us that anything could be wrong. So once we started researching and just seeing all the children who have spina bifida and are happy, and you wouldn't change them for the world. So it was literally just, say, about a week of
horror,
trauma. Yeah, but after that, we haven't looked back.
This baby, another boy, also has the diagnosis of spina bifida.
Spina bifida is a condition where a baby, while developing in the womb, has a hole in the spine. When there's a hole in the base of the spine, it exposes the delicate nerve fibers to the damage from the amniotic fluid. And if those nerve fibers get damaged, the baby can lose the power in the legs and also lose power in the bladder. So a baby can be born without the ability to walk and without control of the bladder.
3 months previously, Sinman had travelled to Belgium to undergo pioneering surgery on the baby while he was still in the womb. The surgery repaired a lesion or gap in the baby's spine, in the hopes that this will reduce the effects of spina bifida and give him normal body function.
This is the extent of the lesion, and it was about 3 centimetres wide, so it was quite a wide lesion on the lower back. Once they had repaired the nerves and covered over the nerves, they then created a skin flap.
You doing okay there? You feeling all right? Yeah? Excellent. Oh. So there's the waters are gone. Excellent. Okay. Yeah. Okay. Now, hello there.
Hello.
So do you want to hold up,
I
baby?
will indeed, please.
Here we go. So now, got him? Hello. Oh, here. Look. Hello. How are you? How are things? He looks great, doesn't he? He's gorgeous. Lovely. Congratulations. He looks fantastic.
The baby will be examined in the Neonatal Intensive Care Unit, but before that, Sinman gets to hold her little boy, named Rufus, for the first time.
We really wanted to kind of get off to as good a start as possible. So skin to skin was really important to me, so I got that.
Hello.
Within hours of his birth, an examination reveals very positive signs that the surgery Rufus had while he was in the womb has been successful. Any benefits will only be revealed in the long term.
definitely brought us closer together. Like
Yeah.
when all the kind of even through like the toughest times.
We know each other fairly inside out now, so that when you do have those bad times or those lumpy times, you know, we're able to, you know,
see beyond it.
See beyond it.
Rufus was transferred to CHI at Temple Street for further assessment. Sinman remained in the Rotunda to recover from her C-section.
You see Daddy tomorrow? There's just a lot of machinery. I'll see him in a few hours. It'll be grand.
Rufus spent 5 days in CHI at Temple Street, and then Sinman, Ian, and older brother Oscar got to welcome him home.
We got home and we had the two of them. We had one each.
Yeah.
Take out of the car and.
And then Oscar just wanted to hold him the whole time. He's like, you know, can I
There's
hold
so
him? And
many
then
photos of
it's just
Oscar holding him.
You know, he's just kind of touching, like as gentle as anything, really. And the two of them just bonding straight away.
Yeah.
You know,
Hasn't stopped.
hasn't
Yeah.
stopped. You know, maybe not as gentle now as they were
know,
once
yeah.
were, but yeah.
Rufus is now 2 years old, and big brother Oscar is 4.
Rufus wouldn't be the child he is now without having had the surgery. Do you know, it is that kind of moment in your life that you kind of think back on that's just changed everything. Like,
He does have mobility in his legs. He's, you know, he's got feeling all the way down to his toes.
but he is crawling
He's
and
climbing.
moving around just at a kind of
Slower.
slower rate than, say, a typically
Yeah.
growing child. He's the one that will be up on the couch on the windowsill before you even know it.
Yeah.
He will be inside every cupboard, have everything taken out. He has been a terrible influence on Oscar.
Yeah.
He's dying to get a go in the wheelchair. So anytime he gets the opportunity, he's trying to climb up into it. And it's kind of teaching him that, no, you have your wheels.
Yeah.
And Oscar has his wheels. But ever since he got his motorbike, it's just, you know, he's got his own wheels and he can fly around like Oscar can.
Yeah.
Both boys have certain kind of routines that we use for the toilet, that when we're out and about we will need accessible bathrooms. Kind of the overarching kind of hope that we have for them is that the world that they live in is more inclusive. And you go to places like playgrounds where, you know, you're looking at the planning and you're thinking, what were they thinking?
Yeah.
You know, the ground surface is completely inaccessible to wheelchairs or buggies even, you know. It was heartbreaking seeing them go somewhere and then think there's nothing they can play with. So we're trying to start that at home by making our home as accessible for them as possible, making sure they can do what they want to do and encourage them to always kind of do their best
Yeah.
at what they put their hand to.
Get them into the mindset that they can achieve what they want to achieve. And for us to give them the support now, so that when they are older, they're like, well, you know, nothing's held me back to this date. Why should it start holding me back now?
In 2019, parents of 2, Ciara and Mickey, were referred to the Rotunda for a fetal assessment scan. When they first met, Ciara was keen to make an early impression.
I texted him.
Yeah, you did, that's right. What time?
I'm 6.
On a what?
On a Saturday night.
On a Sunday morning.
Did you get any rest last night? No. It's just the discomfort.
We went for an early scan.
I need to take a closer look, she said, because she said it seems there's 2. And I said, sorry, what?
Yeah. And I started laughing. Ciara didn't.
So, Lucy? Yeah. And this is Evie here. I think that's the best we can do of the two of them. The two of them together. Evie's bum on Lucy's head.
I was thinking, God, 3 kids under 2. Like, how will I cope? That's what I was thinking. And then I went for my 16-week checkup, and they scanned me. That's when we got the news.
At their local hospital, during a routine scan, they were told some devastating news.
She basically sort of said, your little baby's not, he's going to die, was the term, was the words we used. Your little baby's going to die, and that's the words that stuck in my head.
All of this dark area here is the amniotic fluid belonging to Evie, so this is quite increased. We wouldn't normally see this degree of amniotic fluid. So we can say, compared to Lucy, that she is lacking the skull bone.
I was given the diagnosis that I was carrying the baby with anencephaly.
Anencephaly is a failure of formation of the fetal skull bones, and this leaves the brain tissue exposed. And so essentially what it means is that ultimately the baby has minimal or no residual brain tissue left. Now obviously this is a very serious abnormality, and unfortunately one that means that a baby cannot survive for any significant length of time after delivery.
It sounds selfish now, but I couldn't think. I could only focus on the news I was given, like, you know. And everyone would say to me, like, you know, you're gonna have to, you know, stay healthy, and, you know, you still have a healthy baby in there, and but it took over, you know. I just felt sick every time I thought of it.
It was just filled with worry then. There was no excitement, there was no looking forward to it, and it was, like, my whole head was, like, we just had, always through it, you just had to get through it.
At just 32 weeks, Ciara went into early labour. Their twin girls, Lucy and Evie, were delivered by emergency section.
They had to rush me to theatre. But there wasn't even any time to give me the epidural or the spinal block, so they had to knock me out, which I didn't want because, obviously, Evie. So...
They had no option.
They had no option because the baby, I was fully dilated, the babies were coming.
Evie, sadly, passed away shortly after birth.
It was an hour and 6 minutes. She was alive.
But she waited till I came round.
She did, yeah.
So, that was nice.
Mm-hmm.
I was delighted to see her then still alive. And to get a few minutes even with her.
Yeah.
As soon as she was born, Lucy was admitted to the neonatal ICU. The Rotunda Foundation arranged for Evie and Lucy's hand and footprints to be taken and preserved.
Sorry, chicken. I know. I'm so sorry. That's it, sweetheart. That's it. All done. It's all about making memories. I mean, they started off together so that every memory that you make, as much as we can, we include Evie and Lucy. So, like the clay prints, Mum and Dad would have them together. Now, I might do your toes first. Now, chicken. Good girl. Ah, that's perfect.
They brought Evie out to me, and I was there on my own. I spent the time talking to her and telling her about, you know, telling her about who I was, who her mum was, and her brother, her sisters, and I said about granny, and, you know, grandparents and cousins, and I told her about the dogs. But I wanted her to know all the things, you know, even though she was only there for an hour. She was somebody, and this is what she would have been.
All done. So that's the two of them, so Lucy and Evie.
Well, there's not that much difference in the hands.
No.
I thought Lucy's was going to be a lot longer.
Okay.
We knew they were not going to get much opportunity to share anything, so we hadn't thought about middle names for them. So we called it was Lucy May Brennan and then Evie May.
Perfect.
This side?
Yeah.
It's okay like this?
Yeah, perfect. Hello, little woman. Hello, little woman. No. Goosey goosey. You saying hi? I'm exhausted. Yes. She's worth it. I see you. I do. I do. Yes. Yeah. Say hi.
We went in to the hospital with, expecting twins. We actually left the hospital 3 days later with no babies. And Lucy didn't come home she's there for 10 weeks.
It's all a bit of a blur, really, because we were just so busy up and down with Lucy in ICU. And it was only until you kind of get home then that you start relaxing and it kind of hits you, because it was so intense.
Hi, Lucy.
It was great excitement. Hallie and Annalie coming in to see her in the Moses basket in the sitting room for the first time, yeah. I think she was always such a little toughie. She was so tough from the word go, like. Even though she was so small, she was so fierce, like.
Yeah. Yeah. You thinking? Come on.
In her first year, Lucy developed some issues with her breathing, which is common in infants born prematurely.
The wheels on the bus go round and look at her rather jack face. The mammies on the bus go shh, shh, shh.
Up until this point now, Lucy's been a bit of a lone wolf. Lucy does what she wants when she wants and does not entertain anybody else. And don't get me wrong, she can be affectionate out there when she wants to be, but 9 times out of 10, Lucy just does what she wants, where she wants to go.
She just does her own thing. She's gas. She just leave her alone and she's happy as Larry then. Bit of food, a bit of drink, and just let her do her own thing.
Bit like her dad.
So, this is Lucy's hands and feet. I actually forgot how small they were myself. It's just something we'll always have. It's just one memory we kind of made together with them. And these are Evie's.
It's something you don't get a second opportunity at. Do you know what I mean? You look at them now, like they're absolutely tiny, and obviously Evie's no longer here. So, you don't get opportunities to do anything like that now. And then to be able for the hospital, that charity, to provide them was absolutely brilliant, because it's not something you really push at the time or want to make an issue of, but at the same time now you look back at it and you look at them and you're like, Jesus, still have them.
On her birthday, we were a bit indecisive, weren't we, of whether you didn't want to celebrate. You didn't want to celebrate Evie's birthday on the girls' birthdays.
No, I wanted to do 27th of April was Lucy's and Evie's birthday, but I wanted to celebrate Evie's day as May Day, like the first day of May, purely because that was the day we really said goodbye to her. But also, I wanted Lucy to have her birthday as well. You know what I mean?
Yeah, but it goes without saying, like, whether you're going to celebrate it or not, you're always going to think about it. Like, yes, that's the day they were brought into the world, but that's the day we did say goodbye to Evie.
Here we go, Veronica.
Back in 2018, we met 32-year-old mother of 3, Nicola, who had reached D-Day for baby number 4.
Nicola came over to me for induction. She was an induction because her waters were reducing, so the doctors in clinic felt that she was better off having an induced labour.
Nicola's mother, Kay, will be her birthing partner. Her husband, Emmanuel, will join them once the baby is born.
My husband, he would stay outside, he'd pray for the whole time that the baby comes out safe. I get through it perfect, but it's more of a mother's place, I think.
You come on ahead and you can't surely.
I felt comfortable that, for her to be there actually serves a better purpose than me being there.
Nice meeting you. Hello.
I had 7 babies, 4 boys and 3 girls, and they were very normal deliveries. I never really took anything for the pain. I'd nearly be able to tell them, this is a boy, that's a girl. Boy, girl. I knew the difference of them inside me. The little girls were very gentle, like butterflies. But the boys, I was getting boys' kicks. Little footballer.
And they have a name?
Larkin.
Larkin, that's lovely.
Larkin, because my dad died only 10 weeks ago.
Oh, I'm very
so his
sorry
name
to
was
hear that.
Larkin.
Nice way to remember him.
Yeah, nice.
I used to go for his appointments with him, all of his chemotherapies and everything. And he knew I was carrying a boy because I brought him for the private scan. And he seen the baby in the scan, so that made him happy before he went as well.
You're all right here.
Nicola has taken no pain relief during labour, and now her contractions are getting very intense.
Can't be long more, nurse. Nurse, can't be long more, sure I can't. Please God.
Oh, my stomach is killing me. Go to bed or something.
What do you want to do? No, wait, hold on.
No, are you feeling anything
Hold on,
down
yeah.
below? No.
Are you sure?
Okay. Nice deep breaths,
No.
nice deep breaths. Well done.
I think she's feeling a bit pressure yonder.
Are you feeling pressure?
I think it's pressure she's feeling. No, yeah. I would have loved to be a midwife. I find I can cope and be there for people when they need them, And I mean, I've often told nurses and the ladies that was assisting that the baby is nearly ready to come, and one of them even said back to me, "No," they says, "not for another hour." And within a quarter of an hour, the baby's born.
Guys, I think I might be coming soon.
Okay.
What's wrong?
I don't feel good.
Is it coming
You're
out?
all right, you're okay, you're okay, you're all right, you're okay.
Mommy.
She feels it coming. You're
Right,
okay,
nice deep
sweetheart.
breaths, nice
Deep breaths in and out.
I can't remember.
Of course you can't. No, I have you.
Careful, just mind yourself, don't
You
roll
can't.
off the bed, okay?
You don't want the baby to come out and fall on the ground.
Ma, stop it, please, Ma. Ma, please.
I'm here with
Nicola,
you.
come on, we get you up into the bed, come on.
Ah,
lift
you
your
have to
legs
move up. That's ridiculous. Look.
Come on, lift your legs
Come on,
into
lift
the
your
bed.
legs. Come on, your bum up, push up.
I can't, guys.
Nicola, you
Wait
don't want.
for a minute.
Do you want the baby to fall on the floor?
I won't fall on the floor. She'll get him.
She won't catch him. She can't. She only smell that girl. Deep breath. No, it's okay. Deep breaths in and out. It's okay.
It happened very quickly. The last point I examined her, she was 8 to 9 and the head did still have a bit to come, and we were kind of getting the bed ready for an instrumental if needs be, and all of a sudden it was visible.
Claw, you have, get him out. Come on, yeah. You're all right. You're all right. Come on, that's it. Come on, you're all right. Yeah. Come on, yeah, he nearly has it. Stop. Nicola.
Baby's head is out.
Do you want the head of the bed flat?
Look.
Do you want the head flat?
Relax.
Baby's fine.
You're nearly there, look. One more push, sweetheart.
Nicola was getting very, very distressed. Her mother was trying to keep her calm. My manager was trying to keep her calm.
Help him to get out.
I'm waiting for a contraction. I can't, Mum.
Okay, it's all right, love.
Okay, Mum, you better be quiet.
Oh, God. Just give me a hide. My little baby's sitting there waiting. He's waiting. Like, come on, that's it. He has him. Oh, look.
1734. Oh, you did everything. You were brilliant.
Thank you very much. Oh, you're very good.
Congratulations.
Thank you. Thank you. Gorgeous. Manuel, come up to the delivery suite quick. Congratulations. Your little boy is born.
Thanks.
She took nothing. I said her all the time. When?
Dad Emmanuel's prayers have been answered. Baby Larkin has arrived safe and well.
I mean, once I see the kid, oh, welcome. That's it.
Congratulations.
Thanks. Thank you. At times I do hide my emotions, but deep inside, it's just something that was so strong. It was a stray. You can't describe it, actually. That's just the way it is.
Oh my God, it's beautiful.
Despite the trauma of the labour, Nicola is already thinking of extending their family.
Now that I have 4, I say maybe 5.
Okay.
Everybody give a big smile.
– Larkin is now 3 years old and the youngest of 4.
It was amazing to bring back Larkin to the house because I left as a family of 3 children, and when I brought in the 4th, it was like it was never not there. We couldn't imagine it without him. 3.
I have legs. He's a gas little fella. There's nothing he wouldn't do or wouldn't say. He's like a little daddy. Yeah. He will make them sometimes obey him. Adam, his big brother, that's going on 18. He'll say, yeah, you sit down, I'm the boss. Thank you.
A year ago, Larkin suddenly became very ill.
Larkin was complaining with his belly, and I was thinking, first of all, maybe it's just a little viral infection or whatever. So 12 o'clock midnight, I remember I rang a cab and I said to Our Lady's Hospital, and straight away when they checked him in Our Lady's Hospital, they checked his heartbeat, and his heartbeat was 228. And they said, you know what, there's something seriously wrong with this baby, like, you know. They came with the
resuscitation stuff and all.
And I said, can I ask who was that for? Like, and he said, that's in case we need it for Larkin. And I said, no, please, no. I was crying my eyes out because I knew something bad was happening.
It's always a tough thing looking at your child on the table with people surrounding him.
Helpless, you know.
He couldn't help himself. He was in pain. His breathing wasn't going down. I made a pact with God that day. You know, I said, just take me. I'll trade my life for him so he can live. At least when I go, they still have their life with their mom. That day, I wouldn't say I became a dad that day, but I was willing to sacrifice myself for him.
When they done an ultrasound, doctor came in and goes, yes, appendicitis. And he said, Mammy, see all them bubbles? That's all poison. So we need to get this boy quickly to the surgery.
Larkin underwent emergency surgery to have his appendix removed. He was in intensive care for 6 days.
There was one night he was sleeping, so I was looking straight into his face and I started crying, but not as in, crying loud, but just weeping. And at that moment, he opened his eyes and he looked at me. Don't cry, Daddy. So he became the adult at the time, and me as the adult became the child.
Daddy was happening.
So we had a reversal of roles at that time.
Thank God and His Blessed Mother brought him through that, because it was such a blow.
He's now back to his old self, bossing around his older brothers and sister.
I can see them staying in school and doing their college.
Sammy.
So we just say, we're going to support you in whatever you want to do. And we will, you will make a doctor if you want to make a doctor. We always encourage them.
We try to just bring the best out of them, letting them know that there is still a path that they have to take.
Larkin may be the centre of attention, but it's his grandmother Kay who has been in the spotlight since appearing on the series.
Dozens of people, would say it to me. I seen it on the television. Fair play, you did very well. Not so much about my daughter, or not the grandson. You, he says, you stole the show.
Would it be?
We got invited onto the radio. I said, I just felt like delivering that baby myself. Because you know the doctor was thinking, and I was looking at him then, I just felt like guiding him out. I did. That's what I wanted to do. But anyway, I might get a chance again to do it. I went the other way.
Nicola might just give Kay her wish. She hasn't ruled out another pregnancy.
I think I probably will give it another go.
What?
Yes.
Oh.
Give it another go for Sister for Jessica. Maybe. I'm still young as well.
Oh, Jesus Christ, did you just say that?
Yeah.
God, women.
I think they go for 5, maybe 6.